Good morning, everyone. My name is John Olaechea, and I am a Compliance Assistant Specialist with OSHA, the Occupational Safety and Health Administration. And today I'm going to talk to you a little bit about our workplace violence program for intellectual and developmental disability facilities. But before I get into the program, I just want to give you sorry, I had a little technical difficulty there. I wanted to give you my contact information. So you can see on the slide there, there's my name, my title, and then my phone number is at the bottom as well as my email. I would encourage anyone after this call, if they have any questions at any point. Now, I am, as I said, the Compliance Assistant Specialist for Region 8, which is a 6-state region, including Colorado, Montana, the Dakotas, Wyoming, and Utah. And what I do is non-enforcement. I just provide information to employers, trade unions, or trade associations, unions, employees, whoever needs information. That's what I'm there for. I am not an enforcement or compliance officer. I was for quite a few years, but I have transitioned into a compliance assistant specialist now. So again, I would just encourage you, if you have any questions, feel free to call me. You know, you don't even have to introduce yourself. I know that some employers are afraid of calling OSHA because they feel that they might get an inspection after that. I can assure you that that's not going to happen. So, OSHA, you know, what do we do? If you're unfamiliar with us, we ensure that employers provide a safe and healthy working environment for employees. And we do that through the enforcement of the OSHA regulations, and we enforce those regulations largely through inspections of work sites. Now, during this presentation, what we're going to be talking about is our new emphasis program regarding workplace violence in facilities like the ones that you have. What are we going to be talking about exactly? It'll be an explanation of our emphasis program, then also an explanation of inspection procedures. You know, what should you expect if, when you actually get an OSHA inspection? Because as I would imagine that most of you probably don't have experience with that yet. We'll talk briefly about potential hazards in the workplace, the kinds of things that we would be looking for as inspectors and that you should be looking for as an employer to keep your employees safe. Lastly, we'll finish with some compliance assistance resources that are out there and available to you to help you comply with the regulations. And then also we'll have a question session at the end. So as I said, we're Region 8, and it's a 6-state region. 4 of the states, including Colorado, are what we call federal plan states. That means that the federal government is the agency that does the enforcement of the OSHA regulations. Wyoming and Utah are not federal plan states. They are state plan states. So in those states, private industry is regulated and inspected by the state programs that they have there. So I would just say that this program that we'll be talking about today probably won't really have much of an effect on those states, at least at this time, because they are not federal plan states and this is a federal program. What we have here is a map of Colorado, and there are 2 what we call not regional, but area offices within Colorado. These area offices are the offices that actually house our inspectors who will be doing the inspections. I'm out of the regional office, so it's not one of these 2. You can see the purple line that kind of follows I-70 for a while, and it cuts Colorado in half. The southern portion is under the jurisdiction of the Inglewood area office, and you can see there's their contact number. And then the northern portion is the Denver area office. So depending on what part of the state you're in, your facility would be inspected by one of those 2 offices. In addition, you can feel free to call either of those offices if you have any questions. As I said, call me, but you can also call them. They have phone duty staff manning the phones all week long, and they answer questions. And again, they're not going to, though they are enforcement offices, they're not going to come out and do an inspection just based on some questions. They are there to help you. Now, if they come out to actually inspect your site, they are there in an enforcement capacity. So how does OSHA come to inspect a facility? We have two ways in which we do that. We have what are called unprogrammed inspections and programmed inspections. So I'm going to discuss the unprogrammed first, and that's the bottom bullet point. And the program that we're going to be talking about is not part of unprogrammed inspections. Unprogrammed inspections are inspections that result from a report of an unsafe work site that we receive from the outside. They could be complaints, referrals, or reports of fatalities or accidents. A complaint is just what the name suggests. It's a complaint about an unsafe condition, but it is received from an employee or a representative of an employee. So that could be an attorney, a union representative, even a mother, a husband, some family representative, someone who is either the employee or representative of a current employee. Now, a referral it's a complaint that comes from any other source. So it could be an ex-employee, maybe someone who worked there 2 weeks ago and still has a concern about what's going on there. Or it could be another government official who maybe did a different type of inspection, and as they walked through, they saw something that they were concerned with, and so they report that to OSHA. It could be a client. It could be someone just passing by. We actually get quite a few referrals on construction sites from people that see things on the construction site from a distance. They see people working without fall protection or in an unprotected trench or something like that, and they'll just call us. The last type of unprogrammed inspection is a report of a fatality or an accident. An accident in this case would be defined as a hospitalization, an accident that results in a hospitalization of one or more employees, or the loss of an eye, or an amputation. And actually, employers are required to report fatalities or accidents of these types to OSHA immediately. And so we get reports of those, and then we conduct inspections in response to that. Sometimes if the employer doesn't report it, which they are required to do, but sometimes it's not reported, and we will actually just respond based on a media report, something that we saw in the newspaper or on TV. Now we're going to move to programmed inspections, and that's what we're going to be talking about the rest of this time. We have national, regional, and local emphasis programs. And these emphasis programs are how we construct lists of facilities that we're going to inspect. And the emphasis programs are based on a couple of things. Either a certain type of industry that has a particular hazard present that we are concerned about, that we feel is being unaddressed, or it's an industry that has a high rate of injuries and illness. Here's an example of some of the national emphasis programs that we had last year for fiscal year 2015. These are programs where we have lists and inspectors conduct these types of inspections across the entire country. Nothing here that really relates to your industry. Nursing homes is close. We have a program for nursing homes based on bloodborne pathogens and ergonomics. And then here are regional and local emphasis programs. So we have some programs that affect our entire 6-state region, and we have some that are local, so they only affect the area office. So, for instance, the area office in Englewood, which is southern Colorado and southern Metro Denver, they have a program called asbestos abatement, where they're looking at the companies that come in and do abatement of asbestos before other construction is done. So those inspections are only done in the Englewood area. Up above, you have the regional emphasis programs that are region-wide, and you can see the last one on the list there is the one that we're talking about today, and that was just recently developed last year, and we are starting it this year. So why do we have this regional emphasis program? Again, it only affects the residential, intellectual, and developmental disability facilities, but I can say that, nationally speaking, OSHA has been concerned for quite a while and is making a priority of workplace violence issues. And as you can see on the bottom there, the stat says 76% of workplace assaults occurred in healthcare and social service settings. So that's a disproportionate rate because certainly 76% of the workforce is not working in those settings. And then in addition, we in this region had quite a few complaints in the last 3 years. We had 7 workplace violence complaints at these type of facilities, I believe you called it IDDs. And a number of these resulted in violations, hazards were detected, and citations resulted from workplace violence issues. And 7 complaints may not sound like a lot, but it is a lot from, kind of a smaller industry like this one. And then here is just a slide also showing how healthcare and social assistance is kind of the king of workplace violence incidents. And I should also say at this point, when we're talking about workplace violence and the things that we're going to be looking for, we're not really talking about the kind of one-off incidents that are maybe less predictable, like an active shooter type situation. We're talking about, and we're focusing on trends that an employer should be able to detect in their work environment and that are correctable. So, we're trying to prevent someone or a whole entire staff from being assaulted by the same client over and over and things like that. So as far as inspection procedures, if you do get an OSHA inspection, what will happen is, we'll knock on your door, we'll come into the office, and we will show our credentials. The inspector will start with what's called an opening conference. During this opening conference, they're going to explain to you why they're there. Is this a comprehensive inspection based on an emphasis program, or is it a complaint? If it's a complaint, they're going to actually give you a copy of the complaint. It won't have the complainant's information and identity on it, but you will have a copy of what the alleged violation is. If it's a comprehensive inspection, they'll discuss with you, why we're there, what the program's about, what we hope to accomplish, what are the goals of the inspection. We're also, during this period, going to talk to you just about some background information and ask you a number of questions based on the kinds of things that we want to find or find out about during the inspection. And it's also an opportunity for an employer to ask any questions that they have. The inspector should be able to answer any questions that you have about the process, procedures, your rights, anything like that. And speaking of rights, we're going to discuss at this point employee rights. All employees have the right to speak out about safety concerns that they have. They have the right to make a complaint to OSHA, and they also have the right to participate in an OSHA inspection. So we always inform the employer that they cannot punish any employees for doing any of these types of actions. We then will move to what's called a walk-around inspection. The walk-around inspection generally is going to consist of observing the work site and looking for hazards. Now, in some of these cases, there will be a little less observing of the work site and maybe a little more looking at injury records and conducting employee interviews. Employee interviews are a critical part of every OSHA inspection. They are conducted every time we do an inspection, and they are done confidentially and privately. We take the employee aside without management, and we just sit them down and talk to them about their work experience, what they see when they're working there. We have, some pointed questions that we ask them. And again, the employer cannot punish any employees that they feel may have said something that the employee shouldn't have said. Additionally, during the walk-around inspection, there is the potential for doing sampling, doing different types of measurements. That's probably not going to be happening too much in these types of inspections. We do a lot of sampling when there's, chemical exposures, noise, dust, radiation, those kinds of things that the employee could be exposed to, but I doubt that we'll get into that much in this case. Eventually, we'll do a closing conference. It may be on the same day of the inspection, or it may be that it happens a different day because we have to maybe do a second visit or wait for information from the employer before we can determine, if there were any issues. But during this closing conference, we're going to discuss findings that we have. Were there any hazards observed? If it was a complaint, was the complaint valid? And why was it valid or why wasn't it valid? If there were any hazards observed, will there be citations? And how can they be corrected? These are the kinds of things that we'll discuss, as well as employer rights. Just because we send a set of citations to an employer, that does not mean that it's set in stone and it's a final, final action. The employer has actually a couple of ways to appeal any citations that they receive. So that is one of the things that we really get into during that closing conference. Tips for a successful OSHA inspection. Number one, know the hazards in your industry and especially in your work site. Every employer is actually required to do what's called a hazard assessment of their work site, where they look at the various tasks performed by their employees, and based upon that evaluation, they determine what are the hazards that these employees are exposed to, and then they have to determine how are we going to protect them. And this is a written document that is required for employers to make, and then they have to provide their employees with training on that document. You should also know your injury history trends. Review your injury records from time to time and see if you can spot something that could be prevented. Know the common citations in your industry. The next slide is actually about that, so I'll leave it to the next slide. You should have accessible written programs. Any programs required by the OSHA standards should be accessible to your employees, as well as training records and injury logs. Those things should be accessible not only to the employees and the managers, but also have them ready for the OSHA inspector. They should be something that is easily accessible and provided to OSHA inspector when they ask for it during an inspection. And lastly, prepare your staff to participate in the inspection. That's a pretty important one. It's something that probably doesn't take too much time, but just talk to your staff who might be the ones who answer the door or are in charge of a particular facility on what you expect out of them when OSHA shows up at the door. Do they need to notify higher management? What do you want them to do when we come out? So here is a list of common citations for residential, intellectual, and developmental disability facilities. This was run over the period of the last year, and we have a data system on our website where anyone can get on and put in like your NAICS code and come up with this kind of information. Now, I have put on the bottom a link to this exact table, and there's a few things that are cut off on the bottom, some of the less frequent citations, but if you click on that link, you can go to this full table. Also, from that link, you can put in other NAICS codes and manipulate other things to come up with different kinds of data. But this is, like I said, it's over 1 year, and this is national. So you can see the numbers are small, but that's because we really don't do a lot of inspections of these types of facilities. These are probably almost all complaint related in terms of why we were out there to do the inspection. And from this chart, you can see that the number one citation is 1910-1030 in the OSHA standard. That's under 29 CFR. And that would be our bloodborne pathogen standard. So what we're saying there is a hazard regarding bloodborne or blood exposure in the work site. And all employers who have employees who could be reasonably anticipated to have exposure to blood or other potentially infectious materials in the workplace or in their duties must have a written bloodborne pathogen exposure control plan. And that plan involves things like determining who is exposed versus who isn't, providing hepatitis B vaccinations, providing information and training about the hazards and how to prevent them, and engineering controls that the employer would use and administrative controls that the employer would use to protect their employees and keep them safe. The second thing on the list there is hazard communication. This is about hazardous chemicals in the work site, and this could even include, strong cleaning chemicals and disinfectants that may be used by employees. So if you have hazardous chemicals in the work site, you have to have a written hazard communication program, which is your policy on how you disseminate information to employees about the hazards of the chemicals they work with. 1910-132 is the requirement to do that hazard assessment that I was talking about earlier, where you have to evaluate the tasks that are performed by employees and then determine what the hazards are that are present and how you protect those employees. Now, this one that's appearing in purple, it says 5A0001. That is our general duty clause in the OSHA regulation. And when we don't have a regulation that specifically deals with a hazard, then we fall back on this general duty clause. So we don't currently, though it's been talked about, we don't currently have a workplace violence standard. So we do have this general duty standard that says all employers are required to provide a safe and healthy work environment free of recognized hazards, something along those lines. So when we don't have another standard, we will use that standard, and we can cite people under that. However, it's a little more difficult to cite them. We have to prove that there is a hazard that's recognized by the industry, it's present in that work environment, and there is a feasible means to correct it. I won't go into some of these others that are down further on the list, but if you had any questions about them, feel free to contact me or ask at the end of this. So quickly, as far as this program that we're initiating, it is based on workplace violence hazards. And as I said, the employer needs to evaluate the workplace to determine if these hazards exist or are anticipated. Certainly within the healthcare setting and within your industry, there is the potential for this. You should do an evaluation of your particular work sites. You can determine if there's potential based on injury and illness records, incident reports, client histories or behavioral logs, and employee participation. That's one of the biggest keys there, in addition to having management buy off on it, but also having the employees participate, because maybe there are things that don't show up on these top three items, but the employees have just not reported things, or there are things that maybe don't quite make it to an incident report, but it's still something that should be a concern and something that could help identify a pattern. So if you have issues, then you can have a workplace violence prevention program. We're running a little short on time probably because I have quite a few other slides, but so I won't go into all these, but these are just some examples of some of the things that you can have in a prevention program, including written policy statement, explanation to clients about zero tolerance, a system of reporting safety concerns internally, client behavioral histories I mentioned before. Going down to the bottom, incident investigations, that's very important. If there is an incident, it's very important that the employer looks into that and performs an investigation to determine, why did the incident occur, and were there signs, that there was possibly trouble before it occurred, and what can we do to prevent that in the future? And the results of that should be communicated to the employees. Additionally, you should train employees regarding your workplace violence prevention program, effective methods of responding during an incident, being able to recognize aggressive or assaultive behavior, risk factors contributing to aggressive behavior, and de-escalation of aggressive behavior. In addition, prevention also includes preparing contingency plans to handle clients and maybe even implementing a buddy system. Now, I realize in some of these facilities it's going to be smaller amounts of staff, maybe even one staff in some places. So, the buddy system is a lot easier to do in a bigger institution or a hospital or something like that. But if you have a situation where everyone that deals with client X gets their nose broken, as an employer, you do have to look at some way of dealing with that. Okay, so here are some other things that we could be looking at if we come out and do an inspection, because these would be generally comprehensive inspections. So we're going to look, is there cause for you as an employer to have a written bloodborne pathogen exposure control plan? And, so certainly if you have any of your employees providing medications or taking syringes from employees or from clients and disposing of those, anyone who could potentially be exposed to a contaminated sharp or blood in some other way, that would likely cause you to need a bloodborne pathogen exposure program. As I already mentioned, you need to have a written hazard communication program if you have chemical exposure, and then you may or may not need personal protective equipment. There's always electrical hazards that could be possible in your facility. You just want to make sure that any damaged, frayed wiring is eliminated or fixed. Make sure there's plates on outlets and light switches and things like that. Make sure that if you have a wet location, that any kind of electrical equipment used in that wet location is rated for that location. And then, of course, slips, trips, and falls resulting from general disorder and maybe even wet floors. So what have we done in terms of outreach and compliance assistance to your community? We started, we had to have a 90-day outreach program to begin before we conducted any inspections. And to my knowledge, I don't believe any of the area offices have actually started with any inspections. At a minimum, our outreach program was started with letters to providers, and here's a picture of the letter that we sent out in mass on March 21st. If you did not receive this letter, please contact me and I will get this letter to you, and I will inform our area offices that you did not receive the letter. In addition, we do, other types of things like this webinar today, answering phone calls, other presentations. So those are all things that we'll try to continue to do as this program progresses. Resources that are available to you. This is a really good pamphlet. I shouldn't say pamphlet, it's actually about 40 pages long, but it's a booklet, I would say, on our website, and there's the link to it. Now, that link will provide you an option to download that document, or you can actually put in an order for them to mail you those. However, I did talk with the mailing office last week, and as of right now, I believe they're all out of the hard copies. So I think right now the download is the only option. And I have heard from some people that they had trouble with the download. So if you have trouble with that, go ahead and contact me, and I will get you that somehow, even if I have to download it myself and mail it to you. So it's a really good resource. It goes in great detail as far as, how to evaluate your work site and, what kinds of things you should be looking for, how to investigate incidents, and many options in terms of correcting issues that have been found. We also have other resources. Here is the general page that you can click on to find all kinds of publications. Here's one about medical and dental offices, general things that have to be done in these types of offices. And it's kind of hard to see here, but again, in the healthcare field, you'll see bloodborne pathogens. It also talks about communication, things like that. One of the other big things that we've noticed in the healthcare field that we also look at, and I don't know if we will in this case, if it applies, but ergonomics. When there's patient handling that involves, patients who are non-ambulatory and have to be lifted by employees, that sometimes can cause a lot of injuries. So if you have situations like that, you want to make sure that the employees are doing it in a safe manner. And we have on this publication page and on our website in general many documents about ergonomics. Here's just our general OSHA compliance assistance page. It also has all kinds of documents about training that you can use for your employees, whole host of things listed there. We have a compliance assistance quarterly newsletter that I send out. Actually, a couple quarters ago, we had an article on this workplace violence program that we're starting. And then this is probably one of the more important slides on this whole presentation. So we are federal OSHA, and we do enforcement. But federal OSHA also provides funding in every state to an OSHA consultation program. The OSHA consultation program is run by the state, and this one in Colorado is actually run out of CSU. And it is a free consultation service available to small to medium employers where they will come out, do an assessment of your site, just like an OSHA inspector. In fact, they get the same training courses we do. And they will kind of do, like I said, an inspection just like we would, except instead of writing up citations, they will just write up what you need to correct. And so it's a guide for you, and it's non-enforcement. There's no fines that come from it. It's totally confidential. They don't tell us, where they are, what they're doing. It's between you and them. As I said, they'll do an on-site audit. They can help you with training. They can help with sampling. They can even help you write programs that you may need to write. So they're a super resource for employers that don't really have a lot of funds and staff to, where looking into safety and health is kind of a difficult thing, because the regulations, if you're not familiar with them, can be quite intimidating, I guess I would say. So there's their website. If you get on there, you can contact them by phone or by email. The one thing that I would say is that if you want an inspection in December, you better call them today. They are very busy. There's not a lot of them, and I know that they're behind. So, again, it's a great service. It's totally free. It's a free consultant for you. You just got to call them as soon as possible. Here is our OSHA website. This is a great website. I find it to be one of the best government websites I've ever seen. There's so much information on there. The yellow arrow up at the top shows the A to Z index. So instead of looking at the regulations, which are very difficult to read, especially for the uninitiated, you can go to the A to Z index and look up a particular thing like workplace violence, like ergonomics, like bloodborne pathogens, and there will be a lot of plain language information on there that you can use to get an understanding of what you need to do as an employer. This is just an example of one of our web pages, Worker Safety in Hospitals. It's talking about safe patient handling, things like that. Also, we have our OSHA poster that's required to be posted in work locations. That is available on the website. You can order those or download them. And that's really it for right now. So if anyone has any questions, let me open up the line real quick. If you give me 1 second. See if we had any questions in the chat box. All right, everyone. Any questions for John today?
Hello? Hello?
Hello, go ahead.
So we serve a population, I'm in Montana, but we serve a population that's pretty challenging behaviorally, and there are times when they do hurt a staff person. And we do critical investigations, we do ongoing training. So if we have somebody who calls OSHA to say, I'm being injured at work, what's OSHA going to, what's possibly the responses if we're putting all those, if we have policies in place, training in place, we do critical investigations, we do follow for criticals. If we put everything in place, are we still going to possibly be fined? Because I can't control everything our clients do. It's a pretty aggressive group of people.
Right, I get that, and that's a pretty common question. So let's say we receive a complaint from one of your employees. What we're going to do, how we generally handle complaints is we can handle them one of two ways. Depending on the severity of the alleged hazard and some other considerations, we sometimes will do what we call a phone and fax complaint, where we initiate our investigation over the phone. But because workplace violence is an emphasis program now, we would most likely go to a on-site inspection. And I don't know if I mentioned this before, but all inspections, OSHA inspections, are unannounced, so they're surprise visits. Now, let's say we come out, we get an employee complaint. It sounds legitimate. We're going to come out and do an investigation. We are just investigating that allegation. It's only an allegation at this point. We have to determine, is this allegation valid or not? So if the employee says, well, everybody gets assaulted by this one client and the employer's not doing anything about it, that's what we're going to look at. We're going to review, you said you do these critical investigations. We're going to ask you right at the start, we're going to say, what do you do about this? Well, first we're probably going to say, hey, do you have any issues with clients assaulting employees, and what do you do about it? And that's your opportunity to provide us all these things. And so we're going to determine, is the employer doing what they need to do? Have they done enough to prevent this? Because obviously you can't prevent everything. But, are there continuing, ongoing problems that are being unaddressed? And it's going to be, kind of a case-by-case thing. But many times we do get complaints. We go out and we investigate and we find either the hazard doesn't exist as it's been alleged, or maybe it did exist at one time, but the employer is taking care of it. So just because you get an OSHA inspection, that doesn't mean that you're going to get a citation. And again, even if you get a citation, there are appeal processes that are available to you. So, generally, with an employee complaint, they're a legitimate employee, and they provide us a complaint, and we have an emphasis program regarding this issue, we will start with the on-site investigation. However, that doesn't guarantee any citation. If you're doing, as an employer, if you're doing what you need to do, you won't get a citation.
Okay. Thank you for that question. Karen does have a question online. Do we receive prior notice of an inspection, and what are the employer's rights when OSHA inspectors show up? Okay, so I did mention just a second ago that you do not receive prior notice of an inspection unless it's a phone and fax investigation, and those are probably rare that we would do one of those in this case. But for on-site investigation, we would not, and we are actually by law not allowed to provide prior notice. Now, they will go through your rights as an employer. You do, as an employer, have the right to deny entry, okay? That usually does not happen, but you do, as an employer, have the right to deny entry. Then the OSHA inspector has the right to go back to the office and pursue a search warrant. That generally is something that they would do, and then they would come back again at an unannounced time for the search warrant. But we would have to show to a judge that we have cause to come out and do the inspection. And generally, if we have an emphasis program, they're going to let us do that inspection, or if we have what seems to be a legitimate complaint. But, any other questions that you would have about your rights as an employer, following the inspection, whatever, would be addressed by the compliance officer at that time. And Celeste had a question. She wanted to know if how many employees can an agency have to be considered small or medium for the CSU consultation? Okay, so I don't know the exact amount, and I would say that small to medium would probably be, don't quote me on this, but like under 250, under 250. But I'm not saying that they wouldn't take on someone bigger than that. But I think they prioritize the smaller businesses. Francine from Montana asked if you know the contact for the free consultation in Montana. I don't offhand have that, but if you send me an email, I will get it to you. And in addition, you can find it on our website. I believe the slide,
one of the slides, the OSHA website slide that I showed, it may actually have on there OSHA consultation. But if you want to send me an email, I will send you the contact. But you can also find it on our website.
Another question from the chat box: how much background do inspectors have in the IDD field and understanding the reality of working with high behavioral individuals? Okay, so the true answer on this is it's going to be varied, and there will be some that have very little. As a OSHA compliance officer, we have to be generalists because, today we got a complaint in your facility. Tomorrow we're at a construction site. The next day we're at McDonald's. The day after that we're in some factory or a foundry making aluminum products. So we're all over the place. We need to be in touch with, all these different regulations. And, we get training on how to recognize hazards. So our training is more on how to recognize workplace violence trends and hazards, not so much in this field. And as I showed before, there haven't been that many inspections across the country. A lot of them have been complaint generated, but we haven't had these programs before. I myself have not been into one of these facilities. I've dealt with this in the healthcare setting, but more like in a hospital, something like that. I haven't been in one of these. I would imagine many of our inspectors have not. So it's going to be kind of a learning process, not just for the inspector, but for the offices, as far as, kind of learning on the go in terms of how they deal with these types of facilities. And often, we have to respond to all kinds of things. I did a fatality investigation on a guide who did ice climbing, and he fell to his death while guiding clients, and I had to do an investigation on that. Well, it's impossible for us to know every particular, field out there, every industry. So it's kind of a little research project for us, but hopefully they will send people who have a little bit more understanding about at least workplace violence issues. And so what we're going to be looking at is the trend, and then we're going to get into what are you doing to prevent these issues. And that, the opening conference and throughout the inspection, it's going to be your opportunity to educate us, explain to us what you are dealing with. And, we're going to look at that. We're going to take into account what you tell us. We're going to do some research. We're going to see what the rest of the industry does. And this, if we identify a problem, we're going to look and see what's out there, what can be done, and as an employer, are you doing that? So I would say, we don't have a lot of experience in the IDD field. Bob has a good question in the chat box. With confidentiality of client information, it is assumed that you have the need to know to see client documents, or do we need to secure releases?
Okay. One of the things that they generally talk to you about when they have an opening conference is, with regard to employer rights, is trade secrets and confidentiality. So obviously some companies aren't going to give us don't want to share certain documents, like the formula for Coca-Cola or whatever, if we're doing an inspection like that. If you have concerns, privacy concerns, bring that up right off the bat to the OSHA inspector, and they can work around that with you generally. There's a couple of options that can happen. They could have those kinds of things in a special file that never gets released, or they may discuss. You may be able to narrow their request for documents to not include some of those things, and really question them on why they need that particular document. So those are some of the things. And then in some cases with medical records, we will actually ask or submit a medical access order to the company. So if you have concerns like that, bring it up to the OSHA compliance officer. You may want to ask them to, put that request in writing. It's going to be something that, depending on the document, you're going to have to work out with them at the time. But there are some documents that, we would definitely not want to have, or we would require special procedures to obtain from you.
Francine asked, I am assuming OSHA will inspect a workplace when there is a complaint, or will there be random inspections? Okay, so definitely if there's a complaint, we will respond to that complaint generally within 5 days of receiving the complaint. The rest, this whole program that we're talking about, those are going to be random inspections. So what we've done is we've worked with the state of Colorado to create facility lists, and anyone who received a letter is on the list. Now, from that list, we'll be randomly selecting. We have like a randomizer in our national office who we send in a list, and they send us back the list, and it's been ordered randomly, and then we work off of that list. And so we'll just show up based off that list. Now, we probably won't be doing a whole ton of these the first year. Depending on what we find, we may or may not, increase those. But yes, there will be some random all the inspections off of this emphasis program will be random inspections. Shelley has a question. In the IDD field, many of our providers contract with host home providers. They're independent contractors where the people live in their homes. So Shelley's asking, what is the liability, I'm assuming she means of the provider, with individuals that are placed in these host homes? Yeah, and I know that there's kind of all these different setups in your industry, and that's going to be something that we're going to have to learn about and deal with as the inspectors go out. And I think the area offices are going to have to try and, kind of figure out what's our game plan when we come across these different situations, especially when, we're entering or our list has a facility that's really more of, somebody's home and a private residence. And so in some cases, we may take that off the list and not do the inspection, and that is potentially an option. Another option is conducting the inspection without actually entering the facility, doing employee interviews off-site, looking at records. But in terms of your responsibility to your employees, even wherever you send them, if they are your employees, you are responsible for providing them with a safe working environment. So, just because we don't enter a particular home, that doesn't mean that we might not do an inspection or an investigation of what those employees face. Another question, are similar programs anticipated to begin in other regions of the country? I don't know of any like this yet. I think that depending on what we find here, that may trigger the same thing. If we find that there's a rampant problem in the industry, then that could potentially create copycat programs across the country in other regions. But I don't know the plan as of right now. But I will say that, workplace violence in general is becoming more and more of an emphasis nationally, but not necessarily in this exact industry. Okay, everyone. I know we ran over about 22 minutes or so. We anticipated 30 minutes, but we had some really good questions. Are there any final questions that we want to ask? And if you also have John's contact information, and if you're an Alliance member, we're your resource as well. Give us a call for any follow-up, and we're happy to put you in contact with whoever might be appropriate at OSHA. Thank you all for joining us today. Thank you.